Why is my period suddenly shorter? OBGYNs explain the possible reasons. The length of a menstrual cycle can vary throughout life due to a variety of factors. In my case, periods only lasted a few days for decades. Yet, I started noticing a change after I turned 40. They started getting shorter. It wasn't until I finally finished a box of 16 tampons, which I had purchased a year prior, that I realized a change. Irregular periods should be evaluated by your healthcare provider, Dr. Sarah Toogood, board-certified obstetrician and gynecologist, says. However, it is normal for menstrual cycle length to fluctuate a bit. I spoke to 2 OBGYNs to learn about the potential reasons for my periods getting shorter. It turns out there is a variety of possible factors that may impact the duration of a menstrual cycle. Keep watching to find out what may be causing shorter periods. As a woman gets older, her menstrual cycles may become shorter, Dr. Hack explains. This often becomes apparent in our 40s, especially in the years leading up to menopause. In my case, I am experiencing several symptoms of perimenopause that point to this as being a factor. For instance, waking up at 5 a.m. for no reason. Still, it can be normal for period flow to vary from month to month and also change over time, Dr. Toogood adds. Hormonal contraception such as birth control pills and IUDs may lead to lighter or shorter periods. Hormonal contraception, progestin IUD birth control pills, can make a period lighter, Dr. Toogood says. This is because any hormonal change may affect your period. The menstrual cycle is controlled by hormones, and any changes in these hormones can affect the length of the menstrual period, Dr. Hack adds. Certain medications, such as birth control pills, can affect hormone levels and lead to shorter menstrual periods, Dr. Hack says. Other types of medications or treatments, such as steroids and chemotherapy, can also lead to shorter periods. The period may return to its typical length once the medication is stopped, Dr. Hack notes. Stress, especially if it is chronic, can have an impact on various aspects of our lives, and periods are one of them. Stress can disrupt the hormonal balance in the body, leading to shorter menstrual periods, Dr. Hack says. Too much stress creates an abundance of cortisol, which may disrupt how hormones typically function. Periods of time during which you exercise more intensely than usual may lead to shorter periods. Regular, intense exercise can also affect hormones and lead to shorter menstrual periods, Dr. Hack says. If someone is undergoing strenuous training, their period may disappear altogether. Rapidly losing or gaining weight can affect the length of periods. Rapid weight loss or gain can affect hormone levels and lead to shorter menstrual periods, Dr. Hack says. The body may produce more or less estrogen as a response to changes in weight, which may offset your usual cycle. During pregnancy, menstrual periods will stop and can be shorter upon return of the period, Dr. Hack says. In addition, some women may experience implantation bleeding, which occurs when a fertilized egg implants in the uterine lining. This bleeding happens around the time of the expected period. However, it typically only lasts 1 to 2 days. Breastfeeding typically leads to shorter periods. They often return to their typical length 3 to 6 months after breastfeeding, although it may take longer. Polycystic ovarian syndrome, PCOS, is a condition affecting hormonal balance. It causes the body to develop cysts in the ovaries containing premature eggs. It can affect menstrual cycles in several ways. Polycystic ovary syndrome, PCOS, can also affect hormone levels and lead to shorter menstrual periods. These periods may also be infrequent. The thyroid is a small organ located in the neck and is often referred to as the master gland of the endocrine system. When its function is disrupted, it may lead to hormonal imbalance. Shorter periods may be due to hypothyroidism, when your thyroid is too slow, hyperthyroidism, when it's too fast, or Hashimoto's disease, an autoimmune disorder. Premature ovarian insufficiency, or POI, refers to the instance in which your ovaries stop producing eggs before the standard age of menopause. In this instance, ovaries stop producing estrogen and progesterone. It may lead to early menopause. POI may also lead to irregular or light periods, as well as them stopping entirely. It occurs in about 1% of menstruators. Uterine scarring can occur due to medical procedures, inflammation, endometriosis, or sexually transmitted infections like chlamydia. It may lead to shorter periods because of abnormal blood supply to the uterus. Uterine scarring may also lead to infertility. My final takeaway. There are several reasons why your period may be shorter, from stress to hormonal contraception and PCOS. It is normal for menstrual cycles to fluctuate in length. However, if you notice a drastic change or are worried about a potential underlying condition, consult your medical provider.